So I have a lot of clients who come to me and say, I've wanted to do Botox for a really long time, but I'm scared. And I'm not sure what to expect, and I don't know if it's going to hurt or what I'll look like immediately afterwards. And so we decided to do this to show how simple and easy the procedure is. My personal philosophy is that what we're really trying to do for a woman who has wrinkles between her brows here and up on her forehead here and then around the eyes is to not remove the expression, but to remove the wrinkles and keep the expression. So at rest, when the person is not making expression, then the wrinkles, you shouldn't see them. But when someone is talking or emoting, then you should be able to see that they can move those areas. And that's the perfect application of Botox. Obviously on a clean face, we're cleaning it with some alcohol. Have her turn her head towards me. And we're just going to make a delicate application here.
Stephanie, how does that feel?
It's just a little pinch.
So can you frown, make that wrinkle? Good. She has very strong muscles here and here and right there where we just treated it. So go ahead and relax. We're going to treat these muscles up here as well. Rub it in. And this one as well. That's it. And you see here, she's got three small little bumps that will go down pretty much before she even leaves the office. So now we're going to work on the forehead. Now I want you to go ahead and try and make those forehead wrinkles for me. Good. Now Stephanie has a nice wide forehead, and so what we really want to do is place the Botox throughout the forehead. Otherwise you get what you often sometimes see in people who've had not enough Botox and someone who wants to raise just the brows. They end up with this Spock look, which is not good. But you know, a little raise of the brow is nice and very youthful. So what we'll do is we'll tend to concentrate the Botox here a little bit stronger to reduce the thicker wrinkles. And then as we spread out, we'll do it lighter and lighter. Now she has a big blood vessel running down the front of her forehead. So give me the wrinkles on your forehead again. Good, relax. Going to smooth this out up here to try and spread it out a little bit. And what she's going to do throughout the day today, after she's had this done, is she's going to make those wrinkling motions, and that will help the muscle absorb the Botox so that it affects the muscles that we directly put it into or around. And we're just going to rub like this. And within 2 weeks it will be in maximum effect. And until that time it will gradually start to reduce the wrinkling. And then in 2 weeks she comes back for a checkup to see if there needs to be any additional placement of the Botox, a little touch up here or there if that's necessary. I tend to be very conservative, so I always like people to come back in 2 weeks to see if they need more, rather than put too much in the beginning and have them be really anticipatory for it wearing off.
Now, will she be able to return to her regular activities today?
Yep, we're going to just put a little ice pack on the top. You can do that now. And she's fine. She can go right back to work. She can go right back home. She doesn't have to do really anything special at all.
And how long should she expect the results to last before she needs to come have a whole nother Botox treatment?
It depends on the person, but generally anywhere between 3 and 6 months.
Great.
If we combine this type of treatment in someone like her who's had a little bit of sun damage over her life, we could really even further smooth out those muscles by doing a superficial peel maybe 2 to 3 weeks after the Botox has been in. That way it's paralyzed, so whatever you remove is not getting re-wrinkled immediately, and allows the skin to regenerate itself and really have an incredibly smooth appearance. So that's a nice combination of things to do at the same time.
Fantastic. Maybe you can show us how to do that later.
Sounds good.
Thank you, Dr. Heskett.